Welcome back to this next video in which we are discussing melanocytic lesions. So in the previous video we went over the basic anatomy and physiology of melanocytes, and in this next video what I want to do for you is name the different types of melanocytic lesions shown in our 7 different images here, and we're going to begin with this one here. So this image quite simply shows a freckle. So this small hyperpigmented area of skin, this is a freckle. And freckles are small hyperpigmented areas of skin, generally less than 5 millimeters in diameter. They're generally round in nature, and they're not raised. So if you were to run your finger over a freckle, you would not be able to tell it was there if you had your eyes closed. It feels exactly the same as the rest of the surrounding skin. Freckles are extremely common in people with lighter skin. In fact, nearly everyone with lighter skin will have at least some freckles distributed over their body. They generally arise in childhood, so you don't have them when you're born as a baby. Instead, they arise later on in childhood, and then they generally regress somewhat as you age. So as you become an adult, you generally lose your freckles and you'll gradually get fewer and fewer of them. In terms of melanocytes, what they actually are is an area of skin where the melanocytes are quite simply more active than in the surrounding areas. So this is really important to understand. They do not have more melanocytes. They represent a difference in the activity of the melanocytes. So to put this completely clearly, this area of skin here that is the freckle, the melanocytes in that area of skin are producing more melanin than the melanocytes in the surrounding areas of skin, but there are not more melanocytes here than there are over here. The density of melanocytes is exactly the same. For some reason, the melanocytes here are just producing more melanin, and that's why that area of skin appears hyperpigmented. This also helps to explain why freckles will become darker with sun exposure. So if someone with a lot of freckles goes out to the beach and is out in the sun all day, what will happen is in the following days they will notice that their freckles have become much darker, and the reason for that is that the melanocytes in the freckles have increased their production of melanin even further because of the exposure to UV radiation when they were on the beach. So freckles become darker with sun exposure, they arise in childhood, regress in adulthood, they're very common in people with lighter skin, and they quite simply represent areas of skin where the melanocytes are overactive. Next, let's move on to this picture here. Oh, and they are completely benign. It does not cause any problem whatsoever. So let's move on to this picture over here. So as you can see, this picture again shows areas of hyperpigmented skin. In this picture, we're treated to not just one, but multiple of them. So we've got absolutely loads of them here. And whilst freckles arise when you're a child and then regress as you're an adult, these are going to come on as you age. So as you become older and older, you'll get more and more of these, generally on sun-exposed areas. So these are solar lentigos, and they are extremely common in older people. They also have another name that is going out of fashion, but which you will still hear people use, and that is to refer to them as liver spots. So as I say, call them solar lentigos, that's their proper name. Liver spots is another name that you will hear people referring to them as, but it's sort of going out of fashion as a name for them, because it's nothing to do with the liver whatsoever. It used to be thought that they were something to do with the liver. Now we know it's nothing to do with the liver, which is why that name's going out of fashion. So, just to talk about the nature of these hyperpigmented areas of skin then, these are generally bigger than freckles. So I said freckles are generally under 5 millimeters in diameter. Solar lentigos can be much larger than that. And they're generally not round. They're more sort of splodgy shape. So they have more sort of irregular splodge-like shapes. And they come on as you age. So nearly everyone, as they get older, if they have lighter skin, will get these. on sun-exposed areas generally. So on the hands, the arms, the face are the classic areas where you'll get solar lentigos. And they are related to sun damage. So the more sun exposure you've had over your lifetime, the more likely you are to get a lot of solar lentigos. They are again flat in nature, so if you run your finger over a solar lentigo, you will not feel any difference compared to the surrounding skin. And in terms of melanocytes, what they represent is quite different to a freckle. They actually represent areas where you have more melanocytes. So a higher density of melanocytes. And again, we don't completely understand how this happens, but what we do know is that if you take a little biopsy of one of these solar lentigos and look at it under the microscope, you will see a higher density of melanocytes. Now, these are normal melanocytes in contrast to what we'll discuss later with these sort of things here, the other 5 pictures that we're coming on to. We're going to discuss that the melanocytes in those are going to be quite different. They're not going to have the dendrites. They're still going to be melanocytes, but they're not going to have the dendrites. Whereas the melanocytes in solar lentigos, they still have the melanocytes. It's just that you have a higher density of them. So you're going to have more of them in a given area, but they are normal melanocytes. Okay, so to summarize solar lentigos then, they're very common in older people. If you go and find an 80-year-old person with light skin, they're almost certainly going to have some solar lentigos on their hands and their face. So you can see these very easily when you meet older people. And they are flat in nature. They are more likely to have a splodge-like shape than freckles, and they can be much, much bigger than freckles, which are generally under 5 millimeters. And in terms of melanocytes, they represent an area where, for some reason, the density of melanocytes has become higher. Okay, so there we go, freckles and solar lentigos. And again, solar lentigos are completely benign in nature. They do not cause any problem whatsoever other than cosmetic problems. So people don't like them because they don't like the appearance of them, but apart from that, they are not going to cause any health problem whatsoever. So, the next images that we're going to discuss are these 4. So these 3 down here and this one up here, and then we'll save this one right to last. This is the most dangerous one up here. This is a melanoma, whereas these ones are all moles or melanocytic nevi. So let's write down that name. So change colour first, so we'll go to a nice purple. So the next 4 pictures are all moles, or to give them their fancy names, they are all melanocytic nevi, singular nevus. Now, I'm using the silly old English, British English spelling of nevi here, which has this A here. The American English spelling would obliterate the A and be far more sensible and just be Nevi, but I was indoctrinated with this one, which is why I use it. So as I say, nevi is the plural, nevus would be the singular, so take the I off and put US. So these are all melanocytic nevi. Melanocytic obviously referring to melanocytes, so they originate from melanocytes. So when we're discussing moles, we need to divide them into 2 main categories, which are congenital moles, i.e. moles that you are born with, and acquired moles, which are moles that you develop later on. We have one of these images shows a congenital mole, and you might like to just now have a guess which one it is. So here's the answer. It is this one here. This shows a congenital mole, which is a type of hyperpigmented birthmark. So this is a congenital melanocytic nevus. The other 3 show different types of acquired melanocytic nevi. So, let's start by discussing the congenital melanocytic nevus then. As we'll see with all melanocytic nevi, these represent areas of skin where there are far too many melanocytes. However, unlike solar lentigos, where it's just a higher density of normal melanocytes, in melanocytic nevi, it is a tumour, effectively, a benign tumour, not a malignant tumour, not cancer. So remember the difference between a benign tumour and a malignant tumour, which is what cancer is that benign tumours are just collections, overgrowths of cells, whereas malignant tumours are collections of cells that are very, very abnormal and which are invading into the surrounding tissue and destroying the surrounding tissue. They're acting rather like an infection, effectively. They invade the healthy human tissue, they destroy the healthy human tissue, and even worse, some cancers can be metastatic, where they invade into blood vessels and then distribute all over the body and set up secondary tumours. So remember, that's the difference between a benign tumour, which is just a lump of cells that isn't invading the surrounding tissue, and malignant tumours, which are cancer, which are horrible and invade surrounding tissue. They're like an infection. They destroy the healthy surrounding tissue, and that is very dangerous. All of these melanocytic nevi, these represent benign tumours, benign collections of cells. However, they are not quite normal melanocytes. They don't have the dendrites. They are simpler in structure. So if I draw one over here, so let's just have the skin here again. So this is the epidermis and then the underlying dermis. Melanocytic nevi consist of loads of melanocytes all together forming a tumour like so. So this is what a nevus would look like, and they're not all necessarily connected to the actual bottom of the epidermis where the basement membrane of the epidermis will be. Some of them will be above, but you can see that it represents a collection of these cells, and they don't have dendrites, and these are referred to as nevus cells, but they are still melanocytes even though they don't have the dendrites. Now, there is a big difference between the origin of a congenital mole and the origin of an acquired mole. The origin of a congenital mole is believed to be a developmental abnormality. So a little bit of basic embryology now. And don't worry, I'm not going to take this too complicated. So if we have our developing embryo here, and because I'm going to keep this very simple, we'll just draw our embryo as a stick person here. So this is the basic picture of the developing embryo. We're imagining that we are looking at the front of the embryo and the back of the embryo is facing into the screen. Now, if you know any embryology, and don't worry if you don't, you will know that the brain and the spinal cord, the central nervous system, develops from a tube that is known as the neural tube. If you don't know any embryology, well, you're learning something here. You now know that the nervous system develops from this neural tube that is within the embryo. So this green structure that I'm drawing here, this represents the neural tube, and it will be vertically aligned in the embryo, and the top part will become the brain, the bottom part will become the spinal cord. Now, let's imagine we take a cross-section through this neural tube. So we're cutting it through in the transverse plane. What would we see? Well, we'd see the outside of the tube, like so. That's very basic. There is another structure that is at the posterior pole of the neural tube that I'm drawing here, and this is called the neural crest. And the cells of the neural crest become all sorts of fancy structures in the developing embryo, but very importantly, they become the melanocytes. So let me say this again. So the brain and spinal cord in the embryo develop from a tube called the neural tube that goes from the caudal end to the cephalic end. Okay? The neural tube has at its posterior side a structure known as the neural crest, and the cells from the neural crest migrate away from the neural tube and become all sorts of different things, and they are known as neural crest cells. Melanocytes, incredibly, and this is, it's a phenomenal piece of information. Bizarrely, the melanocytes that are going to cover the entire body come from migrating neural crest cells. Isn't that incredible? Here is where we think congenital melanocytic nevi come from. We think that congenital melanocytic nevi quite simply represent an abnormality where too many of these migrating neural crest cells have all come to the same area, and that's why you end up with a melanocytic nevus. So we think that this structure has formed because too many of those migrating neural crest cells all came here. They formed a benign collection of cells, a nevus here, a melanocytic nevus, and that's where a congenital melanocytic nevus originates from. So these things can be very, very large. Commonly, they're maybe up to 3 centimeters in diameter. So this one here, this might be 3 centimeters across here, maybe 1.5 centimeters across there, and they can be anywhere on the person's body. And they will be slightly different compared to the normal skin. So if you closed your eyes and felt this, you would feel a slight difference. You would feel it slightly raised, not massively raised, but slightly raised above the normal skin, and it may feel slightly different compared to the normal skin. But that is why it appears hyperpigmented, because you've got these nevus cells all collected together which are producing lots of melanin. So that's a congenital melanocytic nevus. Now let's discuss the other three here, which are all acquired melanocytic nevi. This one, and this one. This one being an example of the most common type of acquired melanocytic nevus. So these are not present at birth, they come on after birth, and generally if you're going to get a mole, you'll get it in the first 3 decades of life. We get a little bit more worried about moles that develop later on in life, because they may well be melanomas over here, which we'll come on to discuss in a moment. Acquired melanocytic nevi, they were not there from birth, so they represent a melanocyte that has undergone overdivision for one reason or another and formed a benign tumour. So a cell has overgrown in the case of an acquired melanocytic nevus, but it is not a malignant tumour, it's still a benign tumour. So the question then is, well, what is the difference between these 3 different melanocytic nevi that we have here? So I'll change colour again, we'll go to orange this time. So let's firstly just name them, and then we'll talk about what the difference between them is. So this one up here is a junctional melanocytic nevus. They generally are under 1 centimetre in diameter, they're quite nice and round, and they'll just be slightly raised. So if you ran your finger along this, you would be able to feel a slight difference there, but it's not massively raised above the rest of the skin. Over here, we have a compound melanocytic nevus. This is much more raised. This is a big, big lump. If you ran your finger over this, you would most definitely feel it. It is coming much higher above the surface of the rest of the skin. And the same with this final type here, which is an intradermal melanocytic nevus. And as you can see, this one doesn't actually appear particularly hyperpigmented, and I'll give you the reason for that in a moment. So, the difference between these 3 different forms of acquired melanocytic nevus is quite simply where the melanocytes, the nevus cells, are actually placed. In a junctional melanocytic nevus, the tumour of nevus cells is placed at the junction between the epidermis and the dermis, hence why it's called a junctional melanocytic nevus. So it's just like this picture here. So the tumour is above the basement membrane of the epidermis. It hasn't gone into the dermis, it's still in the epidermis, and this gives rise to this structure here. And of course it will appear hyperpigmented because of all of these melanocytes producing their melanin. In a compound melanocytic nevus, what has happened is the melanocytes of the melanocytic nevus have spread into the dermis. So let me draw this here. So it's not just confined to the epidermis anymore, it's gone into the dermis. Remember, these are still benign tumours, they are not cancerous. So they're not invading, they're not going to destroy the surrounding tissue, but they have extended into the dermis and they're not just in the epidermis anymore. And this is why the thing appears so much bigger, because you have the cells in the dermis, and this gives rise to the whole thing coming much higher up, rising far beyond the level of the surrounding skin. So it's the cells that have gone into the dermis as well. And it's called a compound melanocytic nevus because you have cells both in the epidermis, like in the junctional melanocytic nevus, and you have cells in the dermis. So you have both of them, which is why it's called compound. You can then probably guess what an intradermal one is. This is where the nevus cells are quite simply in the dermis. They're no longer in the epidermis. So get rid of these ones up here. They're now just in the dermis. This is still going to be largely raised above the skin, as you can probably see from this picture. This structure is raised above the rest of the skin, so you would definitely be able to feel this if you were running your fingers over this. However, it's not hyperpigmented because all of the melanocytes are now deep down in the dermis. They're not in the epidermis anymore, so they're not going to be giving their melanin to the surrounding keratinocytes. So actually, you've got a coating of normal skin, normal epidermis above all the melanocytes that is covering up the hyperpigmentation of the melanocytic nevus that is down within the dermis. So that is why intradermal nevi do not appear hyperpigmented. So let's go over melanocytic nevi one final time, and then we'll go on to the final structure shown here, which is the scary one. So, melanocytic nevi, more commonly known as moles. You can have congenital moles and acquired moles. Congenital moles are a form of hyperpigmented birthmark. We have one shown here. And we think that the origin of them is not actually tumor formation as such. It's not a neoplastic change. Instead, it's a developmental abnormality where too many of the neural crest cells migrate to a single area, and then you end up with far too many melanocytes in this portion of epidermis, and hence you end up with a melanocytic nevus. Acquired melanocytic nevi, they form because for some reason a melanocyte has overdivided and formed a benign tumour. There are 3 different types of acquired melanocytic nevi, the most common being the junctional melanocytic nevus. This is where the cells are at the junction between the epidermis and the dermis. They are still above the basement membrane of the epidermis, and it produces a hyperpigmented, slightly raised but not hugely raised area of skin. We then have the compound melanocytic nevus, which is where the cells are both above the basement membrane of the epidermis and below in the dermis. And the portion of the tumour that's in the dermis then is what gives rise to this lesion being so raised above the level of the surrounding skin. The cells above the basement membrane in the epidermis are the reason then that this lesion appears hyperpigmented. Intradermal melanocytic nevi are where there are no melanocytes of this nevus above the basement membrane and the tumour is solely below the basement membrane in the dermis. This gives rise to a very raised lump, but not hyperpigmented because the epidermis above shields the melanin that is present within the tumour below. The thing to say is that all of these are benign lesions. Famously, they do have a risk that they will become malignant lesions, like the final structure that we're going to discuss here. However, that risk is very small. Most moles will not become melanomas. So let's discuss quickly the final picture shown here. So this structure here is a melanoma, a malignant tumour formed from melanocytes. So there are 3 different forms of skin cancer: basal cell carcinoma, squamous cell carcinoma, and melanoma. Basal cell carcinoma and squamous cell carcinoma arise from different types of cells. Melanoma is skin cancer that arises from melanocytes, and it is extremely dangerous. The other forms of skin cancer, they are not nice. They can be extremely destructive and disfiguring to the surrounding skin, so they do need to be removed, but they hardly ever metastasize. They don't spread to other areas of the body. Melanoma, I'm afraid to say, has a very high rate of metastasis. It tends to metastasize to other areas, and once it has metastasized, it is then not possible generally to cure that disease. So, let's discuss melanoma then. So melanoma, it is a malignant tumour of melanocytes. So it is cancer that has formed from melanocytes. So similar to moles, it represents an overgrowth of melanocytes, but this time those melanocytes in that tumour are altered. They have very odd behaviour. They behave more like an infection. They seem to have lost their morals. They seem to have lost their loyalty to the human organism, and they behave more like an infection. They behave like single-celled organisms that just want to increase their own population and destroy surrounding cells. And it's going to form from melanocytes. As you can see in this picture, they can look rather ugly.